following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Hello, I'm Carl Seidel, host of The People's View. The People's View is a show sponsored by the Nashua Republican City Committee. The committee meets every second Thursday at the Crown Plaza. And if you want to contact us, we have a website, nashuagop.org. And at the end of the show, you'll see some contact phone numbers or email addresses that you may want to send us your comments and recommendations. Thank you for listening in.
Welcome to The People's View, a program dedicated to discussing local, state, and national issues and their effect on the American people. The People's View provides a platform for state representatives and national figures to present their viewpoint. Whether it's social, economic, or financial topics, you'll hear it on The People's View.
Hello, and today's guest is Don LeBrun. Don is the incumbent in Ward 5 in the House of Representatives, and he's running for another term. Don, you must enjoy it a lot.
Glutton for punishment, Carl. How do you do?
Thank
Good to see you.
Nice to see you again. Tell us why you decided to go up there for more punishment then.
Carl, I love every minute up there. I honestly do. I am so enthused about getting up in the morning and going to Concord. And all the different things that take place up there and all the bills we hear and the people that come in and testify, the education, everything about it. I just absolutely love getting up to do it.
Well, I know you're very active up there. You got yourself involved in a lot of issues, a lot of different committees.
Absolutely.
Are you going to stay on the same committee?
I certainly hope to.
Okay.
You know, when I first went there, my two choices were Health and Human Services and Veterans Affairs.
Right.
I was fortunate enough now I have both.
Oh, you got on both
I have
of them.
Health and Human Services, and now I'm on the Governor's Commission for PTSD and TBI.
Oh,
the
really?
Permanent Commission was just named. And so I've got the best of both worlds.
Oh, that's
And I'm
interesting.
enjoying every minute of it.
Good. Well, I hope people appreciate the effort you've been putting in. I know you've been a good advocate for a number of good principles up there. Tell us what your biggest thing is that you want to get, the reason you want to get back in. What one or two or maybe three big issues you'd like to see resolved?
I want to continue another term because healthcare is something that, as you know, it takes up 37% of the state budget. So everything revolves around healthcare. So I want to continue with that. We're working on controversial bills. Some of them are controversial. Of course, we've got the marijuana bills and things like that that come up. We're still studying that. The decriminalization, the legalization of marijuana. Whether it'll pass or not, I don't know. But we're listening to people. We're getting the testimony. We're gathering all the facts about it. We also have another bill that's in interim study now on the transparency of medical costs, so that the state is actually setting up a website where a person can go onto the website and find out what it will cost them in various hospitals for a procedure. And you can also go and look at what the different doctors charge. And it's such a disparity in the cost of medical care. You can go to one hospital and a knee replacement may cost you $50,000. Go to another one and it's $8,000.
That's quite a big spread.
It is a big spread.
But I know my son who's has individual insurance had to go around because of his deductible and everything. And he did see more than a factor of 3 between the low and high on just an MRI.
On just an MRI, yeah.
So, but there's a number of things there. How about the effect on the budget of our health care costs? Because I know there's a couple issues that haven't really been resolved. The charge against the hospitals, which they sued for.
Right. Well, there's
And,
only one hospital that's suing.
Oh, it's still, that's
it's
right.
still just the one hospital. It happens to be right here in Nashua, St. Joseph's. They were not satisfied with the settlement that was made, the agreement that was made, so they're still suing. But the other 25 hospitals are satisfied with it.
Okay.
So
But is that a big hole in our budget? And they also talking about Health and Human Services overspending for the first half of the biennium.
Yeah. What's happened, actually, Finance and Ways and Means are more into the dollar amounts than Health and Human Services. We sort of get into the programs, the various programs that are already established, and how we want to implement them, whether we want to increase them, keep them the same as they are, whereas the Ways and Means and Finance get into the actual dollars. So we don't talk about dollars too much. All we care about is if someone's in need, in this state, if someone's in need, truly in need, they should be able to get whatever it is to sustain themselves. We should provide that. The money is there. The problem with the programs that we have in this state is not from the bottom. We don't need to reform the bottom. We need to reform the top. The administration, too much money is wasted on administration of these programs. Every time they come in to talk to us, they need more money. What do you need more money for? Well, we need to hire people to do this, or we need to hire people to do that, or DES has to make rules, and everybody's got a reason that they need more money to administrate.
Are they held up against any kind of standard? I mean, how do they measure cost effectiveness of their programs? There are so many, non-profit organizations that they have contracts with. It must be an immense management problem.
It is an immense problem, but nevertheless, when you take over 50% for administrative costs alone, that's too much. That's a lot too much. You've got to keep your administrative costs down in the neighborhood of maybe 35 or 40%. 60% can go to the program. You can help more people if you've got more money
to do
taken from administration. You've got more money to take care of the people.
Well, is there any way of pushing all those contracts into getting people to merge or something like that, so your administrative course is spread out over more?
The biggest problem,
workers?
and I've argued with every administrator, the biggest problem is overlapping. One department is supposed to take care of one area, but they will overlap into another area so that they're both doing the same thing at a certain point, and then that department's overlapping with another. What they have to do is unify, stick them in one building to start with, where they all know what each other's doing. That's the biggest problem.
They spread out all over the place?
They don't want each other to know what they're doing. We're doing our thing, you do your thing, even though it's, it's duplicity.
Yeah. Well, let's get into one area that has been very much in the public eye, mental health. How is that working out now? Is that covering the people that need the mental health?
Not yet. Not yet, but we're working on it. There is actually a 10-year mental health plan that we're working on, and it's in about the 5th or 6th year now. So it is slowly being implemented, but not fast enough. Mental illness of all sorts is a huge problem in New Hampshire. Drug addiction, that's a mental problem. Alcoholism is a mental problem. Developmental disabilities, they're all mental problems of one sort or another, and we've got to identify each and every one of them. But before we even do that, we've got to have facilities that can care for these people. If we identify the problem now, we still have no place to take care of these people. Concord Hospital, I think, has 13 beds. 13 beds. They put people in a hallway on a gurney, and they may stay there for 3 days before they ever get help. It's atrocious.
Yeah,
it should not happen in today's society. We should be able to provide health care for every single person in this state far as that goes, we should be able to provide it for every single person in this nation.
Yeah. Well,
If we could, if we would do it right.
Yeah, and it seems that these mental health courts too, I think, are serving a purpose, but they're not able to direct the people still to a lot of the requirement, what they require.
Yeah, they can identify the problem.
Yeah.
But again, there's
Because you
just
don't want
not
to put them in
adequate
jail.
facilities. No,
That doesn't
there's
help.
not adequate facilities to send them to. And now we have the Veterans Court,
Right.
which is great. That just started up about 3 or 4 weeks ago, right here in Nashua. And the problems that veterans face are now being identified, and instead of throwing them in jail,
Yeah.
we're trying to get them treatment. They're being directed to different programs to try to help them, and they have to report back to court that they're keeping the appointments and such, and that they're getting the care that they need, rather than throwing them in jail and forgetting about them.
But there is enough of these groups that are able to service those people in need. Is it just in the bigger cities, or is it throughout the state?
No, it's throughout the state.
Okay.
Yeah, it's throughout the state.
And do they undergo some kind of surveillance by the HHS?
Yes, they do. They're directed by the court to seek certain treatment and to report back to different agencies proving that they have done this and what they're accomplishing. And then they have to report back to the court along with their portfolio, or whatever you want to call it, that the departments send back with them to show that they're on the right track. They're trying to rehabilitate. So
it sounds like it's enough to keep you busy, and you're still taking on even more than just HHS.
I can't take on enough, Carl. I can't take on enough. Yesterday, I was in long-term care, and of course we're looking into different things that need to be changed in nursing homes and things like that, and to keep people in their home without sending them to nursing homes.
Right.
But you have to have the staff to go into the homes and care for these people. And that's where the infrastructure sort of falls apart right now.
I know several years ago, before my wife passed away, we had home services. It seemed to be very good in this area anyway.
Yeah.
I had nothing to complain about at all.
We're trying to give authority to some, and I don't want to call them lesser caregivers, like LPNs and LNAs and whatnot. We're trying to authorize them to be able to do things that they're not able to do right now. Yeah. Which will help tremendously, because if instead of sending a registered nurse into a home, if you can send an LNA in, and they can do everything, including giving medications, whether it's injection or what, after being trained to do that sort of thing by an RN. Yeah. And that's what the kinds of things we're trying to accomplish. And we're making a lot of headway.
So I think that's the best way of doing it, for both for the patient and for the state.
Yeah.
As well.
Caregivers are a huge problem right now. There just aren't enough of them. And that's the reason we're trying to expand it, so that and I don't want to keep calling them the lesser, but the inexperienced, less experienced, can go and do some of the things that up until now it takes an RN to do.
The person's relatives or something probably are very, for the most part, are more conscientious too.
Right.
They take care of the person, because they're so close and so much loved by the person.
Right.
And they'll be more attentive, I think.
Oh, sure, sure.
But I can't encourage you more, because I think that's what's needed to keep our costs down.
Yeah.
You know.
I mean, absolutely. It costs so much less to keep someone in their home than to keep them in a nursing home.
Right.
I mean, the cost is probably 30% less. So there again, that's saving money on the top end so that you've got more money on the bottom end.
Yeah. Well, a nursing home's awful expensive. I think
they
it's
certainly
more
are.
than 30%. The nursing home, so what they charge, it's something else for assisted living. Even.
Maybe it is more than 30%, but I try to be, a little bit cautious when I
What are we going to do to balance
out.
the budget this last half of the biennium?
We've got to cut spending.
Yeah.
The past 2 years, we've spending money that we don't know if we're going to get. We've got to cut that out. You can't run your household that way. Mm-hmm. You've got to know ahead of time whether you have the money to afford something that you want. If you don't have the money, you don't go out and get it. What we've been doing for the last 2 years is going out and getting the product first and then saying, oh boy, the bill's going to come due. How are we going to pay for this?
Yeah, that's terrible. I mean, the forecast for the income was right on. You couldn't get much closer than that.
It was absolutely
and
right on the spot.
Now, due to somewhat of a lack of transparency, we don't know where we are.
The last figure I heard...
Well, let's say the public doesn't know where we are.
The last figure I heard is somewhere in the neighborhood of $30 to $50 million.
Yeah. I've seen estimates as high as $100 million.
Have you?
And so I don't know whether
I haven't seen them that high, but I've seen 30 to 50.
Well, it's something that they have to balance out. It takes them a while to balance and see where all the accounts are. But with the computers, they should be able to do it right away, shouldn't they?
You would think so.
Yeah.
You would think so.
Well, Don, good luck in your running. People, you need help.
Are we finished already?
Well, we've run out of time, unfortunately, Don. But do you have anything to say about getting people to help you in your campaign?
I'm running for re-election. I'm working hard. I want to serve the people. Mm-hmm. And if the people will allow me to, I would totally enjoy and feel honored to go to Concord every day and work for the people of Ward 5. And not only the people of Ward 5. I get emails daily from people all over the state. And if I can't do anything else for them, I make sure that I put them in contact with a local representative that can follow up on it.
Okay, well, that's very good.
And that's the way I do things. Okay. Everybody in this state is my constituent.
Uh-huh. Well, good. They ought to be happy with that.
I certainly hope so. Good luck on your
primary, and hopefully we'll get back together again in October and talk about your final run to the finish line.
All right.
Okay.
The race is on.
The race is on. Giddy up and good luck.
Carl,
thank you.
Thanks so much. Appreciate it, buddy.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.